Okay, good morning. So, we started Shin Chof Ches yesterday. Let's just quickly summarize what we said. Very important halachas regarding refuah. We said that there are 5 categories of illness on Shabbos. The first is pikuach nefesh. And there we said in Sif Beis that a person is in a mokum sakana. It's a mitzvah lachal lovis HaShabbos. And Hazorah is Harizeh Meshubach. The one who rushes to Kul Hatzalah is Meshubach, is praiseworthy. V'hashoel, the lashon of the Mechaber is Harizeh Shofech Domim. Someone asks a question about it, is Shofech Domim. The Mishnah Berurah brings the Yerushalmi, V'hanishal. Okay, that's what we spoke about yesterday. Then you've got, Then we've got the next category down is Sakonas Eva. And there we said an Eini Yehudi can do a Deraisa, and an Yisrael can do a Drabonon. Then the next category down is a Choyle She'ein Bo Sakana, which we defined as Nofel Mishkov. So he feels so shvach that he's got to be in bed. Or Nechlash Kol Gufa, his whole body is weak. Or we said also any hospital patient is automatically a Choyle She'ein Bo Sakana. And for him or her, then you do an Eini Yehudi can do a Deraisa. So it's very important to know that Cholish Sakana, you can tell a non-Jewish person to do even Deraisas. And then you have a Chele B'miktsas, where you can do a non-Jewish person can do an Issa Drabonon. And then you have Michush Ba'alma, the 5th category, is just a very mild headache or something like that. And that you can't do really anything. For a mild headache or something like that, you can't even take a paracetamol. You can have Michael Briam, you can have a hot bowl of chicken soup, or you can have a whiskey if you're feeling a little bit of a sore throat. But you can't tell people you're having the whiskey for that. But you can't take proper medication. So those are the 5 categories of chayla that we spoke about yesterday. Okay, let's carry on. Si'if Dalet. So we're Shin Chof Ches Si'if Dalet. Maka shel cholol. A person has an internal infection. Einat Tzricha Omed. You don't need, that's already very serious, and therefore you don't need an estimation, which means a doctor to give an assessment of how serious it is. If you've got an internal infection, then we just treat it very seriously. Shafilu ein sham bekiem v'chela eino meklum. Even if there are no bekiem, there are no doctors around, and the chayla himself is not saying anything. Oisim loi kol sheragidim lasos lebechol. You do whatever is needed, even that you would do during the week. You just press on. Avol kashayadim umakirin ba'isachayli. But if you know and you recognize this illness, shemamtin ve'ein tzarich chilul, that you can wait till Motzei Shabbos and you don't need to be machal Shabbos in any way, then also lachalov, then you can't be machalal. Afal pi shehi maka shel cholol, even though it's an internal infection, which we normally take very seriously. Okay, says the Mishnah Berurah, Siv Katan Yud Gimel. Einat Tzricha Omed Pirush Imhu Mesukan L'Sha'asa Elai. So you don't need an estimation whether or not you need to deal with this urgently, but because we just say, just get on with it, just do whatever that you need to do if he's got this internal infection. Kol Sheragilim Mimacholim Urefuas, whatever you would normally do, whether it's in terms of his diet or whether it's in terms of medical intervention. Even if there's no sakana in waiting, since this illness involves danger, there is some need, and you would do it during the week. You're allowed to do it on Shabbos as well. Even if you do some sort of chil Shabbos here, ein mechal la de Yisrael ela b'davar sheish lochush by shem lo yaseh lo yichbad alav cholyei v'yuchal listaken. We only do it if we're worried that it might deteriorate further, that it might endanger him further. But if holding back is not going to cause any danger at all, even though they would normally do something for him, because if you're certain that just doing nothing is not going to be any damage, then fine. Then you can treat him as a Cholesh B'Sakana, and you ask a non-Jewish person to do it. The Alkain bevadai me'anochen lahachme be'issa shel Torah, and therefore, if you're involved with Surah Torah, then you should certainly try and avoid doing anything yourself and get an Eini Yehudi to do it in this situation. Okay, Kashayadim. So this Sif Cotton Tesvav. And if you know that delaying is not going to cause any harm, then you should delay. Says the Mishnah Berurah, Sif Cotton Tesvav, and certainly, if the Chayla himself says, listen, I don't need anything, I'm okay, then she'ein machal, then you don't need to machal because you can trust him in this situation. And if you know that waiting is not harmful, then you can wait. You know with certainty that the illness is not going to get worse. But if you wait till Motzei Shabbos, then you should wait till Motzei Shabbos. Okay, good. Hey. Some sort of wound that is not internal, then nishalin bebaki uvachole. You check with an expert, a doctor, or bachole and the chole himself. Ve'in mechalin of Shabbos, and you're not mechal Shabbos ad sheyome echad mehem, where either the baki or the chole say shel tzarich lechil. You need to be mechal Shabbos. Oy sheyase etzel echad mehem sakonas nefashos. Or that you treat it as a situation of sakonas nefashos. That is what it's deemed to be. Says the Mishnah Berurah, sakonas nefashos tzarich lema sofik sakonas nefashos. That even as we know, we're mechal Shabbos even for a sofik sakonas nefashos. For rotzolema dafilu omrim rak shemi yichbad olav hachole v'yistakein. Even if they say that it might deteriorate and get more dangerous, nami shari, that's also allowed. V'zeh shesim aramov v'ayin lekam siman tov reshut ches. Okay, so two very interesting footnotes here. First of all, regarding Sophic, actually three footnotes. This first one is number 19. This actually goes on the last shtickle. If you look, so if you look at the first couple of lines of footnote number 19, she'ein tzorech lahamtin ad sheyechle u'mutar lekachas trufa b'Shabbos k'dei limnoa samach lemilovei. Now it's quite an important point. So I'll tell you where this has relevance. Say, for example, a person is prone to migraines, and right now you've got a mild headache, but you just know yourself, you feel it coming on. So are you allowed to take paracetamol or whatever you take in order to prevent something which right now you can't really take medication, but you know that you will? Says Rosh Zalman, yes. And although there are some poskim who disagree with this, but in Shmir Shabbos it's brought, and this is what he brings over here, to take preventative medication. If you know you're going to get a migraine, that would be okay. That's what Rosh Zalman says. And then if you look at 21, in the case of Sofik Sakana, he says, "V'tam hadova shemechalim Shabbos al Sofik Sakana." What's the svara that you can be mechal Shabbos in the case of a Sofik Sakana? Ve'ein soimchem ala kosuv shome pesoim Hashem. It's a Sofik. So say, apply the pasuk in Tilim, shome pesoim Hashem. HaKadosh Baruch Hu protects the foolish, which that's the famous Ramesh invokes it with smoking. That's the big discussion about that. But shome pesoim Hashem. So kosuv hakovetz shiurim. Rabbi Chanan says in Ksubas, she'ein kosuv ze oisek. It means a situation where you can't, you're not in control. What can you do? You take an airplane, or whatever. Maybe that's not actually a good example of it. But Shem is a situation where you're not, it's not in biyodai. But if it's in your situation to protect yourself, it's a cold and you don't go out with a coat or a scarf or something, HaKadosh Baruch Hu is not going to help you if you don't wear a coat in the winter, and therefore the sofik sakona she'ena kaimes b'hoiver el rak asida likros kosav hachaznish she'ena bichlal sofik pikuach nefesh. Okay, so that's one of the svaras of sofik sakona, and then he said lastly that he said, if you look at 22, also an interesting note, of the Geder Hetezeh Kos B'Shal Shuva Shevet Levi, Shesofik Pikuach Nefesh Deiche Shabbos B'Teres Vadai. It's an important point. It's not a sofik. We're not sure. Maybe you can. Maybe you can't. Can call up Tzala. Maybe you can't. Sofik Pikuach Nefesh means you've got to. It's B'Teres Pikuach Nefesh is Deiche Shabbos B'Teres Vadai. You've got to do it. You're not an expert. You don't know if this guy is a life-threatening situation. But like we discussed yesterday with that fellow, the Golker who had a stroke, so he just was sort of wobbling a little bit, and he was an older man, and he was slurring his words. That's a suffix sakonas. You've got to, b'teres vadai, you've got to call us hatzolah. V'lo b'teres suffix b'vad, mishum shater tzivsa b'chiyu vadai lahatzin nefashos gam Im ein b'zeh el sofik pikuach nefesh. V'yesh b'zeh kiyum ratzon Hashem shelo v'anoshim b'dei sofik sakana. Kodesh Baruch Hu wants a person not to get to a situation of sakana, and therefore, even in a sofik situation, b'teres vada, you have to intervene. Okay, Vov. Makash al gav hayad. The person's got a wound which is on the hand, v'gav haregel, on the foot, an external wound, v'chein mi shebola aluka. The Gemara talks about this often, that a person who swallows a leech, it was more common in those days. That's why the Gemara says, the Rambam brings it, that you can't put your sort of drink directly from a pipe or guttering, because you don't know what's going to come through. You might be boleh and aluka, some sort of leech, or someone is bitten by a wild dog, like a rabid dog, or some sort of creepy crawly, even if you're not sure if it's life-threatening, Hari Haim Kamaka Shel Cholol, and therefore you treat it very seriously, then you can be Mechal Shabbos. There's no Mishnah involved, let's just do Zayin. Mechal in Shabbos al Kol Maka Shenasis Machmas Barzel. If there's an injury that was brought about through some sort of metal item, an iron implement, Val Shchin Haba B'Piatabas, or if there are boils B'Piatabas in the rectum, Val Stoma, which is some sort of illness called plunkar. Val mishiyeshbo kadachas cham b'yoseh has got a very high fever. Im simur, or in simur. So what's all this? Says the Mishnah Berurah. Al kol maka. Says the Mishnah Berurah Sifkat Yudches. Afilu eina bechalal haguf. Even if it's not internal. Va'afilu shelo agav hayad regal. Even if it's not necessarily on the hand or foot. Or cham b'yoseh has got a very high temperature. Hu hanikra beloshen Ashkenaz tipus v'chudeimeh. I wonder if this is typhus, maybe. Typhus comes with a high temperature, maybe. Im simur miloshen tesamer sa'aras psari, based on that pasuk. Hu hanikra sheiderin beloshen Ashkenaz. He says the bottom is tzvamuris, which is I think like shivers or chills or something like that. Shebo hakrirus v'chamimus v'hamachas. You're sort of oscillating between high fever and cold. La'afuke kadachas hamotzu, as opposed to a regular sort of headache or sort of fever. Shebo tchilas hakrirus v'achkach hachamimus. You feel cold in the beginning and then you feel quite hot. Ein ze b'chal cholesh yesh b'sakana. So we're talking about a very specific type of illness. Where you feel sort of simultaneous cold and hot. So either way, for a non-Jewish person, would be Mechal Shabbos for these situations. Okay, so let's leave that there. But so there we have it again. Just to repeat the categories. The categories are the important things. But pikuach nefesh, you just do whatever you can. A heart attack, a person collapses, a woman in labor. Mechal Shabbos, it's a mitzvah to be Mechal Shabbos. Hazor is Harzeh Meshubach. And then the next one is Sakonis Eva. The guy can do a Deraisa for sure, and even Israel can do a Drabanan. And then the next one down is Chedesh Em B'Sakana, which is Nafel Mishkav, or Nechrash Kol Gufay, or hospital patients. You can get an Ein Yehudi to do even Deraisa, and then Chayli B'Mikzas, you can get a non-Jewish person to do a Drabanan. And the last one is Michush Ba'alma. You can't really do anything apart from Michael Brim that we spoke about. Say that.